Hi, everyone who's joining. We're just going to give it a couple minutes to join Facebook Live as well. Thanks so much for joining us today. I am Katie Dashiell, and I'm the Content Marketing Manager at Supplemental Healthcare. And today I'm joined by two recruiting experts from our team. So we have Dan Smith, who's a Senior Regional Manager, and Randi Worner, a Senior Regional Director at Supplemental Healthcare. So they're also going to be at TravCon in Vegas next week. So if you're going, you can stop by, say hi at the booth. And then also they're wearing our lovely Travel with SHC shirts. And so we're going to give away a couple of those for people who do ask questions. So if you do have a question, put it in the chat or the Q&A. So the questions that we're going to start out with is just how to get started in travel nursing, trends that we're seeing now, and what the most in-demand needs are. So again, like I said, if you have any questions, ask away, and we'll be giving away some shirts. So we'll go ahead and get started with a couple just standard questions. So Dan, I'll ask you first, kind of basic, how do you become a travel nurse?
Well, the first thing you should do is really a little research on where you want to go and really correlate it to what you've been doing. So some people travel to see the country. Some people travel to go see family members. And you really want to narrow it down first into what your needs are. Second thing you should do is you research on a company and then get a hold of a recruiter. A lot of times, if you know a travel nurse and they have a good recruiter, it's good to reach out to them and just come prepared with questions, like the things that you need to know as a nurse that are going to make you feel most comfortable to be on an assignment and most comfortable to be the best nurse when you're there. So being prepared is huge, but then getting in contact with a good recruiter who can give you the information that you're looking for and that you need.
Awesome. And then kind of along those same lines for Randi, how much experience do you need to become a travel nurse?
So I'm going to answer this question twofold. When any nurses that are going to school right now and you're looking for staff positions, get in the specialty that you want to stay in. It's very hard to get in a specialty and then transition. So for example, if you want to be an OR nurse, make sure you apply to a hospital that has an OR RN opening, because let's say you get into med surg and then in a year you want to transition to OR, it's really, really hard. So that is first and foremost. And why that's so important is because when you apply to us, we can only place you in that specialty. So if you're a med surg nurse right now and you want to become an OR travel nurse, you can't, unfortunately, because when you are a traveler, you get oriented maybe for a couple of days. That facility expects you to hit the ground running. So they want you to be specialized in whatever you're going to be working for them. So 1 to 2 years of experience in the specialty that you're going to be working in. And then we look for basic certifications like BLS, ACLS, NIH stroke. The license part can get kind of tricky if you're a compact licensed nurse. So if you live in one of the compact states, that's very good for you in your situation with traveling, because you have, dozens of states that you don't have to apply to. You can use your compact license. And then most recruiters will know the license information. So if you have a question about a certain state and how long that processing time takes, your recruiter should know that information.
Great. And then, so kind of along with that, how long are travel assignments usually, Dan?
Travel assignments usually go 13 to 26. It really depends on what you're looking to do, how long you're willing to stay. We usually recommend taking the first 13, seeing if you like the facility, make sure you're happy there, make sure you're comfortable there. We always ask for the opportunity to extend after that. It also gives you a chance to try an area. If they have a few different facilities, we can kind of go back and forth between a couple different facilities and make sure that you find the right fit for you.
Awesome. And then Randi, how long does it take to start an assignment?
That's another great question. So there's unfortunately no formula or scientific way to get that answer, but it depends on what you're looking for. So if you want something to start right away within the first 2 weeks, tell your recruiter, hey, I'm looking for an ASAP start. I need a paycheck right away, or I need to get to this area right away to visit a family member, whatever it is. Make sure your recruiter knows what you are expecting of them. Turnaround time on most assignments is anywhere from 2 to 6 weeks. So from the time you interview to the time that you start at a facility could fall in that 2 to 6 week window. So just make sure you're very vocal with your recruiter on what you're looking for. And then also ask your recruiter, what's the turnaround time on this facility? You know, how fast are they at interviewing? Because you have your recruiter here typing away every day, doing follow-ups, pushing for interviews. Sometimes it can take a day. Sometimes it takes a couple weeks. So just make sure that you're also open to listening to your recruiter when they say, I know you really want this facility, but they're very slow with turnaround. You want to start in 2 weeks. I suggest this. So recruiters are going to be your subject matter expert in how fast or how much time you have in between starting an assignment.
Awesome. Yeah, that's really good advice. And then we kind of had a question come through that I think is very similar to the next one that we have on our list, kind of talking about how does travel nursing impact your taxes? But this kind of folds into my next question for you is what factors may affect your pay package? Because I think we're going to get a very similar answer here where there's different stuff and is very unique to, you know, the person in the situation. So
For sure.
Yeah.
For sure. So to start, any pay packages are going to come directly from the facility. Everything is facility specific. They give us a package and we break it up into taxable, non-taxable wages. Taxable, we do go with the GSA website that the IRS gives out. So we take that money and we break it up into taxable, non-taxable, depending on how many days you're going to be on assignment, how much you're traveling to, and then we take the rest and we put it into your taxable wages. Now, taxable wages are going to depend on the location you go to as well. Some states don't have state taxes, some do. So it's really going to be specific as to where you go. Any advice, we always recommend seeking a tax professional to make sure you get that tax advice. We can do the best to our abilities, but we are not tax professionals. So it's really going to depend on the area. It's really going to depend on the situation. And that, once again, as Randy said, should go back to your recruiter and to those questions. That communication with your recruiter is huge in the beginning to make sure you guys are on the same page.
Great. And then Randy, what happens after someone completes their assignment?
So in regards to retention, that should be very important for your recruiters. So when you are, screening recruiters, screening companies, figuring out who you want to work with, ask them what their retention plan is. How do you find my next assignment? When do we talk about it? Am I able to extend at this place that you're submitting me to now? So make sure that you're asking those questions. I personally, with my business, typically, as Dan mentioned, all of the assignments are 13 weeks. So halfway through, so at about that 6-week mark, I should already know what you want to do on that next assignment. We should have already had that conversation. So then I'm going to say, hey, Katie, I know we talked, at the beginning of this assignment, you want to go to Georgia for your next assignment. These are the assignments I have available. Has anything changed? You looking for anywhere else? So halfway through your assignment is a good starting point. Now, if you do a shorter assignment, 8 weeks, 4 weeks, then you kind of got to start talking really early into that assignment of what am I going to do next? So, and I also manage a team of recruiters, and I can't tell them how often that I preach this. It's never too early to start submitting. So it's better to be proactive than reactive and finding something last minute and being stressed out. I want to take the stress off your plate.
Yeah, definitely. So Dan, what are the benefits of the nurse licensure compact? I know Randy kind of mentioned this in a previous answer, but can you kind of talk a little bit about that too?
The benefits of having a compact license?
Yeah.
Gives us more opportunities to place you. So, having a compact license gives us more options, we'll say. If you're traveling specifically to make as much money as you can, we can filter through different facilities and see who's willing to pay that OR nurse the most, or that ICU nurse the most, or who has the highest need. So once we get involved with those facilities, we can present you with better options. And for example, kind of to branch off what Randy said, if we're 6 to 8 weeks out and you have a compact license and we're looking for what's next and you want to make a couple dollars more, having a compact license gives us more opportunity to bring you different places. So better presentation.
For sure. And then Randy, what parts of the country are you currently seeing the most needs in, like state-wise right now?
Oh my gosh, everywhere. No. To get more specific, typically now prior to COVID, we always had like flu season was our big push in the fall time for the southern states. So we have all the snowbirds that typically go down to their southern houses, and that's when we see the census spike up for flu season. So generally it's down south at this time of year. With COVID, it's kind of changed everything. So I honestly want to say we are seeing needs not only down south, but California is the big one. New York State's a big one. Some of the upper East Coast ones like Connecticut, Vermont, Massachusetts is a big one. So those are also very good questions to ask your recruiter and see what they're seeing in their market, because all agencies have different clients, different facilities, different contracts. So if you're looking for a specific state and that company doesn't have it, I can guarantee that there's another company that will have it. So, but at this time, I would say down south and probably California are going to be our most needs. And again, if you don't have that compact license, like Dan was talking about, talk to the recruiter about. Some states right now have emergency licenses. So you can literally get a license within a day. Some of those states are offering free emergency licenses. And then some are just quick turnaround where it only takes a week. So sometimes you can be submitted to a facility and not have that license yet because you already know you're going to apply for the emergency. So again, communication is key with asking your recruiter. Don't be afraid to ask a million questions. When I have a traveler, they ask me a lot of questions. I feel very confident in them starting a travel assignment because I know that they want to learn and they kind of want to be a mini expert in that field already. So the more questions you ask, the better.
Yeah, that's definitely good advice. And yeah, I feel like all of your answers, both of you have been, have that partnership and the communication with your recruiter, because they can really help you out for that. So kind of along those lines, as far as what's in demand, Dan, what specialties are you seeing as like the highest demand moving into the fall?
All of them. Right now, there's so many facilities that have needs. ICU, med-surg, tele. Randy mentioned OR a lot. I know before with the first round of COVID, we didn't have a lot of the OR needs, and now they seem to be open up as well across the country. So there really isn't a swing of specialties per se. It's more facilities are just looking for nurses across the board, good candidates. People are going to make it through the compliance process. People are going to, make it to orientation, those types of things. So there isn't a specific specialty. We have a focus on the ICU, med-surg, tele in my branch, just to make sure that we can run them through the country and make sure they have plenty of options as well. So whatever specialty you are, come on board.
They're just available, yes. So Randy, with those new jobs and the ever-changing needs, how can someone stay updated on new jobs in real time?
So a lot of companies have technology that can send you job alerts. Supplemental healthcare, for example, has what we call job matching. My favorite tool, I've been here 15 years, and I can tell you it is the best thing in the world. So basically you call me and you say, hey, I specialize in telemetry. I'm interested in A, B, and C, these locations. Can you keep me updated on them? I put all those states, your specialty, into our job matching technology tool, and it alerts me real time. So as soon as a nurse manager posts that job in their hospital system, I get a real time notification. It's kind of like a red notification on Facebook, and I don't like red, so I click it right away and I reach out to you and I tell you. And then there's also options where you can go on our website and select job alerts for you, and you can also select how frequently you get those. So 1 time a week, 3 times a a week, or if you want them all the time. So most companies do have that technology. So that's another good question is I would ask them, how do you get alerted about jobs? How are you going to alert me about those jobs? The more you're in the know, the more you're going to be able to navigate, because there's so many companies, so many different recruiters. But it's speed to market. You want to know right away when that job is, because if your recruiter isn't on it and submitting you right away, there's probably 50 other applicants already. So again, communication is key with your recruiter on that.
Definitely. And then kind of a more general question for Dan. How do I decide if travel nursing right now is right for me?
That's a good one.
That's a really good one. I kind of prefaced in the beginning as having those list of questions and those needs that you have as a nurse, where you want to go, how much you want to make, what you want from a recruiter, what you want from a company, having those needs, and then speaking to a couple different companies and doing your research and making sure that your needs are met up. Your needs are what are most important. You're the one that's on the floor. You're the one that's taking care of the patients. So if your needs don't match with what the company has to offer or travel nursing has to offer as a whole, it might not be the right time, but having that knowledge and having that information and reaching out and seeking communication from different companies and different recruiters is really going to make you be able to make that choice for yourself. And that's the biggest thing, is you being comfortable on the floor, taking care of patients. That's number one.
For sure. And so then we have a couple other questions, but just as a reminder, if you are just tuning in and have questions, go ahead and type them into the chat or the comment section, whether you're watching this on Zoom or Facebook Live. We're giving away some of these Travel with SHC shirts. So be sure to ask your questions. And then I do have a more general question just for both of you. Just with everything going on right now, what challenges do you still see given COVID-19, just in relationship to travel nursing?
You want to start or you want me to go, Dan?
Ladies first.
So the pandemic has really, really changed everything, right? Between jobs, going out to eat, schools, just everything. I've been here 15 years. I was here during the recession, where it was really, really, really tough, and there were hardly any travel nursing jobs. And I can say with COVID-19, it has presented kind of the opposite effect, where we're kind of flooded with so many positions right now. A lot of facilities are short-staffed. There's nurse burnout right now from these nurses that have been doing it for so long. So travel nursing needs are probably at an all-time high, I would say. Would you agree with that, Dan? In
Yep.
Our careers here, an all-time high. So it has changed a lot. It has also changed the way that, and this is my favorite part about it, is the way that nurses are compensated. Compensation is also at an all-time high that I've ever seen in this industry. And I feel like nurses are finally getting the fair wages that they have deserved for a long time. So COVID has definitely helped shape that. And that's one thing. I get goosebumps as I'm talking about it, because when I hear about what some nurses are making as a local hourly rate and how many patients they're taking care of and have worked through COVID and have worked all these hours, and I hear what they're telling me they're making, and it's like, your heart just breaks for them, because what's out there in these other opportunities. So it's definitely changed a lot. The other thing is too, with these facilities being so short-staffed, is the patients. So it's like, number one, I want to say, if you want to travel right now because the money is so lucrative right now, definitely it's a great time to start your career. But in the end, I know this is why I do this job. I know this is why Dan does this job, and Katie, why you do this job. We want to make sure patient care is number one. We want to be able to put your expertise in these hospitals, help these staff nurses out, take care of these patients, and just do what you signed up to do, and is just to help people. So to be a part of that through this pandemic has been very, very rewarding for me personally.
I agree that you can't hit the nail on the head any better with compensation. From nursing before, and I've been here for 6 years, Randy's been here for 15 years, to see, nurses getting compensated as they should is huge through the pandemic. This is, you guys are front of the line, you know, you guys should be compensated as such. So it's really rewarding on that side to see things. And that's one of the major things I see coming out of COVID-19 is that staying.
For sure. And then kind of our last question to wrap it up, unless anyone else comes through with some, both of you, is there any other advice for travel nurses that you guys have?
My biggest thing is communication. Talk. Even if you don't think we want to hear it, we want to hear it. You know, we're going to be your best advocate. We're going to be your sports agent. We're going to find exactly what you're looking for. Being on the same page is huge, and you can't communicate enough. So
Yes.
that's my big thing.
Agreed. And like I had said before, to ask a lot of questions. Obviously, you know, we know that nurses are probably talking to multiple companies and recruiters. I would do the same thing if I were in your shoes. That being said, when I have a traveler that's reaching out to me multiple times a day, multiple times a week, they're moving up on my list of people that I'm working with, because I'm like, man, this woman wants it. She wants to travel so hard, or this gentleman wants to go so bad with his family and take them to California for an assignment. So it's like the more that you reach out to your recruiter, the more that they know how much you're in it, and they're going to push more with those facilities to get you turned around. So over communication is key in this industry.
Definitely. Well, thanks guys for answering all those questions. It doesn't look like we have anyone else coming through with something additional, but I don't know if there's any specific plug you want to give for TravCon, just like you have the booth number, or that you'll be there, you know, on whichever days, but.
We don't have a booth number yet, but we'll be there
Okay.
Monday and Tuesday. You can come find us.
Yeah, easy to find.
Blue and
Perfect.
gold, and we'll have stuff too that we're going to be giving away at the booth. Come ask your questions there. We can send you, you know, we can start the whole process right there and send you the profile, get your resume. We can start everything there. We can get you in touch with a recruiter that hour if you want to start hearing about jobs. So we, like I said, we are speed to market. We're fast. So come see us and we'll help you out.
Perfect. Well, thanks both Randy and Dan for joining us, and everyone else who tuned in. And if you have any other questions watching this recording back, you can still leave comments and we will follow up with you. Thanks, guys.
Thank you.
Thank you.